Hi, I'm Olivia Simon with MedChi, and I am here with Gene Ransom, CEO of MedChi. Today, we will be discussing the Episode Quality Improvement Program, a value-based Medicare incentive payment opportunity for Maryland physicians. Welcome, Gene.
Thanks for having me, Olivia. I'm chair of the EQIP Committee for the state of Maryland, and I really enjoy the work that we've done together on EQIP. And I know you've been a key part of signing up for year three, so I'm really excited to talk a little bit about EQIP and what the Episode Quality Improvement Program is all about.
So, Gene, can you start by explaining why EQUIP was first created?
So essentially, EQIP, the Episode Quality Improvement Program, was first created essentially because Maryland has a unique total cost of care model, different from any other state. We have a Medicare waiver that pays hospitals differently and creates a different kind of dynamic in healthcare finance from other places. As a result of that, the federal government, through CMS, the Center for Medical Services, did not allow some of the advanced payment models to happen in Maryland. And MedChi really wanted to make sure that every physician had access to value-based care and advanced payment models. So we lobbied very hard to create two very successful advanced payment models, one for primary care doctors called the Maryland Primary Care Program, which was started several years before EQIP, and the second, which is actually an opportunity for all physicians because we have bundles for lots of specialties and we can add more. But essentially, EQIP was that second advanced payment model, and the EQIP program, or the Episode Quality Improvement Program, was created by the HSCRC, the Health Services Cost Review Commission, CRISP, which is the Maryland Health Information Exchange, and MedChi to create this voluntary episodic incentive program. EQIP's a voluntary program that engages everybody on the physician side to really be the quarterback for a bundle or an episode. The great thing about this program is the risk is not at the physician level. It's taken at the state or the hospital level. And it allows physicians, if they want to avoid MIPS participation, because this is an advanced payment model. And it also allows physicians, if they want to just take that advanced payment model, or they can take the fact that they're in this program and use it to really enhance their MIPS score. EQIP, it was really set up to have the physician focus on outcomes and quality of care for the patient and less on volume. So it's a really good program for physicians to focus on better outcomes, lower costs, and being rewarded for managing all the costs, not just the ones that they're directly responsible for.
Can you explain how the episode-based payment works?
Right. So this is actually one of the cool things about the program, Olivia, and I know you know this because you're helping MedChi with the smaller practices, with the MedChi network services EQIP entities. What really happens for the physicians is very little changes except for the mindset and the fact there's an incentive to really look at costs outside of the physician. So the first thing is the physician signs up for EQIP and they agree to an episodic arrangement. They then get full fee-for-service payment. There's no change in their Medicare payment. The payment still comes directly to them. There's no reduction. However, for each episode they've signed up for, there is a target price that is set that includes all the costs, hospitals, nursing homes, everything else outside, and a target price is set for the physician to try to manage and lower the cost and look at ways that they can improve quality outcomes. There are three quality measures that the physician is trying to achieve. One is end-of-life planning, medication reconciliation, and BMI. They're all done on claims. So the great thing about that is there's really no extra reporting on the front end. It's just reporting those billable items. And those quality measures can be done either by the physician who's managing the bundle or another physician who touches the care. So the goal is that the patient gets better care with the physician being incentivized to look at key quality measures that will improve outcomes. And then at the end, you assess the performance. The physician gets the benefit of being an advanced payment model, which means they either get an advanced payment bonus or the for lack of a better term, juiced MIPS score. So that's benefit one. And then benefit two is if there's shared savings on that total, they can win on the shared savings as well. If they've hit savings, they can get a percentage of savings based on how they do. based on actual performance period costs less than or equal to the target amount. Even if there's no savings, the doctor still gets the advance payment bonus or the MIPS scoring bonuses, whichever they choose. So it's a win no matter what. The only downside is if they don't have savings 2 years in a row, they're not going to be able to participate in the program. It's a really cool model, and it's just impressive how it's kind of worked out for everyone. Olivia?
Sorry, can you explain the EQIP interventions?
Yeah, so essentially when the physician, and a physician has a choice, they can either sign up by themselves or they can sign up separately. Essentially, when they sign up by themselves or separately, they still need to focus on and tell CMS through the CRIS portal which interventions they're going to do. And the docs can decide to redesign how they're doing the care. They can add care management or care transitions, and they can engage with the patient in a different way. All these things can help focus on outcomes as well as trying to achieve the extra requirements, the extra quality measures that are involved so the patient gets a better outcome and other things that might not be normally dealt with in that bundle occur.
Now, Gene, what are the requirements to participate?
So the requirements are pretty straightforward. You obviously have to take Medicare because it's a Medicare program. It's a federal Medicare advanced payment model. You have to be in Maryland. It's a Maryland only program right now. Although I'm really hoping that we can convince CMMI to expand it because it's been so successful. You have to have enrolled in PCOS, which is the Medicare provider enrollment chain and ownership system. And every physician should have done that anyway after taking Medicare. And then second and third, you have to have a certified EHR, which they call CHIRT, and you have to be linked in with the Maryland Health Information Exchange, CRISP. Now, the cool thing about being linked in with CRISP is it's totally free, and MedChi can help you do that. It's very easy. Once you hit those requirements, which are pretty straightforward, you just have to hit the attribution levels. You've got to meet an episode, which requires 11 episodes in the baseline and 50 episodes across all for participation. If a single physician can't hit that number, they can be in an EQIP entity or a group. So you simply enroll in EQIP when enrollment is open, and you go from there. It's a pretty straightforward process, and it's pretty easy.
Finally, can you give us a little rundown of how EQIP did in year one?
So this is a really big success, Olivia, for Maryland. EQIP year one. And again, we started working on developing this back in 2019, 2020, and it took us a long time to get everything done and approved by the federal government and up and running. So our first year of full operation was 2021. And in our first year, we saved the state of Maryland $20 million in total cost of care. We only had in year one less than 10 episodes, just a small number of episodes around three specialties: GI, ortho/neurosurgeon, and cardiology. Those three episodes, or those three areas, those three specialties, and it was about 6 to 8 episodes, were about $40 million in cost, and we saved $20 million, and $13 million of the $20 million was paid out in incentive payments to physicians, close to 60% of the total earned. This was really, really impressive as far as a first-year result. In year two, we added more bundles, and we just started year three in January of 24. And year three, we now have 50 different bundles and countless specialties involved. We also, Olivia, are working hard to constantly add new bundles and expand the program as we go forward. So if anybody has ideas on things that should be bundles, or if they want to know if their specialty is covered, we're very happy to help them out with that. MedChi did also, and this is part of why you work for MedChi, Olivia, is we created infrastructure to help smaller practices and group them together so they wouldn't be left behind, because some of the smaller practices had trouble hitting the attribution limits, and we wanted them to take advantage of it as well. But MedChi is also providing support and help to large corporate practices, to hospital practices, and we're also helping with some of the bundle payment stuff. So it really has been a cool, successful program for Maryland and for Maryland physicians, and we're hoping it's only going to continue to grow.
Thank you so much, Jean. If you would like to schedule a meeting about EQIP with your organization, you can reach out to either Jean or myself. Jean, do you have anything else you would like to add?
No, I just would really encourage physicians to take the time and learn about this and learn about the opportunities with regards to the episode quality improvement program. We're really looking at achieving the triple aim here. We're trying to get better quality outcomes for patients, most importantly. We're trying to incentivize physicians to think about the total cost of care. And we're really trying to look at having a better situation with regards to cost, quality, and outcomes, the triple aim. And we're very excited about this. If you have an idea for a new bundle, or you want to learn more, or you want to sign up, or you want to participate, or you want to, maybe you're in it and you want to do better, we are here to help. MedChi, working closely with the state and HSCRC and CRISP, are really proud of the work on this program, and we'd love you to be part of it. So please reach out. And Olivia, thank you for having me today.
Yes, thank you everyone for joining us today. Thank you, Jean. And again, please reach out to MedChi if we can help you in any way.